Morning, everybody. My name is Binta Garba Bello, a nurse midwife working with one of the teaching hospitals in the northern Nigeria, Kano. Being a nurse midwife, I happen to be working in the labor ward, and I happen to be trained for EMOTIVE, and I'm even given the chance of being a champion, a coach, and a coordinator. We are here in another session of presentation about EMOTIVE. I'm here with some of the midwives and community health officers. We do mentor almost everybody that is coming into labor ward to learn how to manage patients, especially as we have said, the most commonest causes of death in our women now is condition of eclampsia and postpartum hemorrhages or any hemorrhages disorder. Now I'm going to talk about what the EMOTIVE is referring to. We want everything to be done within a shortest possible time, as we have said, within how many minutes? 15 minutes at most. And what he is referring to early detection of blood that is contained in the drip. Before, if somebody is bleeding, we are only using estimation of blood. So now it is agreed that as soon as a patient has delivered her baby, then before the delivery of the placenta, you drop down your drip under the patient so as to trap whatever amount of blood she is to lose. Then you deliver your placenta. So what we mean by early detection is once the drip is there, the blood loss is contained in the bag. It means it's just at a glance. The drip will tell you whatever amount of blood is lost. Then M is referring to massaging of the uterus. If you have enough hands to do, the medical personnel can do it. If you are less in the facility, your patient is conscious and stable, she can do it herself. Or a companion that is beside her can assist you to ensure that the uterus has contracted. Then the O is referring to administration of oxytocins of any kind, not only oxytocin. Oxytocin is there, agometrine is there, misoprostol is also part of it. So anyone that you think tend to be more efficient and effective in your own center, and that is what you routinely use, you ensure to have administered it, that is oxytocins. T is referring to tranexamic acid. We have talked of coagulation disorder as one of the causes of continued bleeding after delivery. So it takes care of that, coagulation disorder. I and B is referring to intravenous fluid. Normal saline especially is a blood expander. Before you are able to get your blood ready for transfusion, this will assist the situation to expand the blood and allow the woman to remain in her conscious state. Examination and escalation. Anything that you may need, I have talked of IV is there. Ringless lactate, normal saline are here. Gloves are here. Giving set is there. EMOTIVE has really given a great impact towards the control of women that has been bleeding, that has bled amount of 500 mils and above during delivery. Since the introduction of EMOTIVE, we happen to know that if we are to give any care, it has to be in a form of bundle within the shortest period of time. And that is how it has been right after the introduction of EMOTIVE program. And with that, we have recorded so many achievements. One, there is prompt alert to any person taking care of a patient, because whatever amount of blood is lost is seen there and then after the delivery. Because keeping the drugs in one place is really reducing our tension of moving from one place to another. We do have some referral cases from the local settings, especially the rural areas, primary centers. So I think one of the challenges is to be taken care of is by expanding the program of EMOTIVE to even the local settings, so as to ensure that the control of the PPH is starting from the grassroots. And the delay of transporting, in the course of transporting the patient referral from a lower sector to the higher sector, may even not be there. So whatever is to be taken care there will be taken care of prior to thinking of referring a patient with a complication. Apart from expanding it to the local settings, is to include it into the curriculum of the students. Any school that is health related training school should have it added into their curriculum for the students. So if the knowledge has been expanded and everybody is exposed to know what is PPH and how to go about controlling it, it will have been much better to the people of the community and the women at large. The coordinators, the organizers of this EMOTIVE, the NGOs, World Health Organization, the University of Birmingham, our own country level, our principal investigator, our side leads, EMOTIVE champions, the research midwives, the entire people that worked in the maternity section have been trying their best. Since the introduction of EMOTIVE, we have seen positive change towards control of PPH, and our mortality rate out of PPH has drastically gone down. Thank you, everyone.